Okay, so we're going to start with some hip mobility. So just allowing your hands to rest here will get your legs nice and wide. And then we're just going to slowly lower one leg at a time, just going down to the as much as the hip will allow you to go. And as you're pushing that knee down, I want you to think about breathing in to lower the leg and exhale as you bring it back up. So inhaling down, exhale up. Inhale down, exhale up. So at least 30 seconds of these, or 10 to 12 on each side. And then we will move over onto your hands and knees. So I'd like you to first just do like a few cat-cows, so just really rounding through your back, and then bringing your chest through, letting your pelvis and stomach drop down. So a good like 30 seconds of these. And then we're going to start pushing your hips back towards your heels, and then we're just going to do this forward and backward motion. So you can either have your feet so that your laces are down, or with the toes curled up underneath you. I think that you get a little bit more hip movement and low back stretch with the laces down. But again, you can kind of switch or alternate between the two. So again, another like 15 to 30 seconds of that backward movement. So we're really trying to focus on pushing that hip as far back. I even like to use my hands to create a little bit additional pressure, pushing into the ground as I rock back. And then we're going to stay in that kind of turtle shell position so that the hips are back towards the heels. And then placing one forearm down, the other is going to go behind the head. And then I'm going to tap the elbow to the forearm, and then exhale to rotate as far as you feel like you can go. So inhaling to tap the forearm, exhale to rotate. So we're going to get at least 10 to 12 on each side. So moving through both sides for your rotation, maybe noticing some differences side to side. You can always do an extra set on the side that feels a little tighter. And then going through another hip mobility here. So just back in our all fours position, you can work on rotating the foot out. So my hip is just driving down to the ground, and I'm just rotating that foot out. So again, with this one, I want to inhale to bring the foot out, exhale back in. So I'm just opening up into some hip internal rotation here, which again we'll do about 10 to 12 on each side. And then we'll lower all the way onto your stomach. You can do that just going all the way down, or if you want to kind of go into a little down dog, allowing your heels to kind of pedal out a little bit, just getting some movement through the legs, and then coming down onto your stomach. So we want to kind of shake the hips out a little bit just so the lower back is nice and relaxed. And then we're going to mainly just use the arms like how we would in a push-up. So placing the hands by your chest and inhaling as you come up. You can even go do a little neck movement here, and then control yourself back down. So getting good 10 prone press-ups. If it's starting to get uncomfortable for the lower back, you can always put a pillow or a yoga mat under your hips, or you can just go up just a little bit less into like a place where it's not uncomfortable. We don't want to try and push past that pain. We want this to be just creating a little bit more extension through your lumbar spine and some space to the front of the hips. And then next we'll go into that kneeling position. So we're going to tuck the tailbone in so you can already kind of feel a little engagement through the front of the hip. And then I want to bring that arm up. And so I'm coming more upward with my movement, and then just a little bit forward, rocking that front knee forward, and then I can stretch over to the side. So you're getting a good long body stretch through here. So I'll just do that again. So I'm going to tuck the tailbone so you already feel some engagement through the front of the thigh. I'm thinking more upward then forward, and then I'll reach over to the side. So just doing about 15 to 30 seconds here, just making sure that you're breathing in through like the side of your ribs and exhaling as you come back out.